You don't know me. Probably never will.
But I need you to do something for me.
Something that could literally
change everything.
You'll never get a thank you card, and yet I need you to do it.
And if that weren't enough, I need you to do it as soon as you are able to.
If you do this for me,
I'll do it for you.
And for every single person you love.
Deal?
This is our shot to leave COVID behind.
Greetings and alafia to all. My name is Raven Freeborn. I'm the Senior Policy and Advocacy Manager at Mamatoto Village. And today I have the joy of talking with you about what we aim to rectify and how. But first, before we get there, a little bit on Mamatoto Village. Mamatoto Village is an agency that was started in 2013. We are devoted to serving Black women, and that is Black women of all experiences, through the creation of career pathways in maternal health and providing accessible perinatal support services that are designed to equip women with necessary tools to make the most informed decisions in their maternity care, parenting, and their lives. I like to tell this story about how I have had a career crush on Mamatoto Village for many years, and it is the values that really resonate for me. Our values spell the mnemonic I this, and we really mean that. By that, we show up with inclusion. We make sure that collaboration is at the forefront. We are advocates in every sense of the word. We really want to amplify pathways towards respectful care. We believe in equity, and we pursue equity through justice. We believe in support, integrity, and accountability, and service. Our care model is based off of relationships that are crucial to effectively addressing social issues and positively impacting outcomes. We'll talk about what those outcomes are in just a few moments. But our approach is team-based, and our clients relate best to those folks who understand their community. Later on, you'll hear me say, we are the why and you are the how. But this really demonstrates how we become the why. We understand that racial disparities can prevent successful engagement and the establishment of trust. So this team approach really supports people in community with a holistic wraparound service model. At Mamatoto Village, we offer support through with our perinatal community health workers, our perinatal care managers, our family support workers, our lactation specialists, our wellness specialists, and our care specialists. And ultimately, our timeline of care begins at intake and moves across the experience of pregnancy through 12 weeks postpartum. And what we know about what we've done from data in 2020 when we had to pivot during COVID, as did other home visitation programs, was that we were able to maintain 102 healthy babies. We gifted 5,100 diapers. We prepared 50 plus emergency food bags and distributed other essential items like clothing, hygiene, kits, car seats, and sleep resources to 180 families in need. We conducted more than 3,765 virtual telehealth visits and maintained an 84% participation rate with our clients. It's important to note that since we began delivering services in 2013, Mamatoto Village has maintained a 0% maternal mortality rate, and we have lost one infant since enrollment in our program in 2013. So again, we are the why, and we'll talk a little bit later about how you become the how. But we know that as a village, we take care of our mamas. And so throughout pregnancy, we are with people for the first 3 months of an infant's life. We're with people to provide comprehensive, culturally responsive services. And ultimately, this includes health education, care coordination, labor support, breastfeeding support, and counseling. You know, as we're here today, we understand a little bit of the why. We know what it looks like in DC to be Black and birthing. Our work exists in the backdrop of statistics that paint a grim picture for Black women and birthing people. And while we acknowledge the threat sustained, high intensity trauma, and historical divestment in Black thriving, we seek to reauthor stories, to set in motion multi-generational legacies, and to serve as a convener to support efforts of community transformation through social change. Mamatoto Village has this unique perspective of providing whole person, justice-centered care through the 3 generations approach, which ensures that women and birthing people and their families are not only heard, but given their basic human rights, which is respect. This is what we actually aim to rectify. It is also important that folks have a pathway by which they can forge self-determination. This pathway will lead to thriving and the ability to bring Black children into a world where who they are does not threaten the essence of their existence. So what does it mean to center the Black woman and Black birthing people in the process of seeking justice and rectifying social inequities? Well, we really amplify reproductive justice and birthing justice. And even in this process, our goal is to seek other ways to bridge justice opportunities and justice-oriented solutions into the achievement of reproductive justice and birthing justice. And ultimately, this is highlighted in our perinatal workforce training program. This is the essence of the We Are the Why, because we recognize the problem and we are looking forward to creating an opportunity where the solution looks like those folks who are navigating life experiences where they don't have access to dignified healthcare. So our community members are sought after for their expertise and supported in completing the perinatal workforce training program, where folks learn to serve their community as a trained perinatal health worker and lactation consultant. And ultimately, we are part of the solution, thereby increasing the number of Black women employed in maternal health and having a positive effect on the local economy and the well-being of the family. During this process, we're going to talk about self-advocacy, and we're going to look at all the ways in which there have been historical barriers to the process of self-advocacy within healthcare systems, specifically focusing on that which is the birthing process. So I know that there's a little bit of distance in our learning platform today, but I hope that you will join me in being responsive to some polling questions. So right now, you have an opportunity to participate in a poll. And in order to do this, you have to open your phone and text what's on your screen, Raven Freeborn, text Raven Freeborn 506 to the number 22333. And if you can look to the right of the screen, you'll see that there's a little example. Once you text Raven Freeborn 506 to the number 22333, you'll receive this message that says you've joined Raven Freeborn session. So I'll wait a minute until folks are able to do that, and I'll repeat the instructions. You're going to text Raven Freeborn 506 to the number 22333. So this workshop allows us to actively reflect together. And though you may not be able to see all of the results, I'll be sure to read them out with you or out for you as I offer the question. So last time, text Raven Freeborn 506 to the number 22333. Our first reflection question: describe your most positive healthcare experience. You can use your cell phone if you text Raven Freeborn 506 to 22333 to respond to that question. And I actually have it open on my screen, and I'll be able to read some of the responses that come in. But ultimately, when we're thinking about self-advocacy, we really want to identify what has been positive about people's experiences within and outside of the healthcare system. We know that the barriers to Black maternal health and to thriving Black families, part of that is about the social inequities and health disparities that are experienced outside of a person's pregnancy and into their postpartum period. So some answers that are coming in about what barriers and challenge, describing your most positive healthcare experience. Folks are saying that their pronouns were respected. Their most positive healthcare experience was loving. It was a full night of care. Other people are saying that they had a dedicated person who was able to support them in the process. Another person said, the doctor held my hand when I asked them to because I was there alone, scared, and in pain. I'm really glad that you had someone with you. Someone else shared, the provider was very present, wanting to understand me as a person. We have many responses coming in. Folks are saying connected. My births were very positive due to the support of my doula. She made me feel safe, heard, and confident. She inspired me to enter birth work. Welcome to the world of birth work. I'll read a few more. Someone said, no shame. Getting connected to a new PCP who was a Black man who actually listened to me and was willing to do what he needed to help me as a Black woman was refreshing. And the last one I'll read. My doctor listened to all my concerns, big and small. You can continue to send in your healthcare experiences that were positive. And I'm just so thankful that folks have these stories to share, because we know on the other side of the divide of statistics when it comes to Black birthing people, our stories are grim. And as someone who believes in the achievement of birth justice, reproductive liberation, and justice for all people, it is not my responsibility to engage in the statistics and stories of trauma that may re-trigger us, right? There's this fetishization, or an obsession with hearing Black stories related to death, related to loss. However, there is positivity in our general existence. And so this is what Mamatoto Village hopes to highlight and amplify, is that there is a process and a way to rectify the issue of maternal health disparities by making an intentional decision. So our organization embodies the values reflected in our mnemonic, I care, sis. And we really go beyond the lip service and towards a framework that promotes livability, promotes thriving Black futures, and promotes the advancement of justice. I'm seeing some of these responses are still coming in. There'll be more opportunities to reply, so keep your phone nearby for the next reflection question. Ultimately, we at Mamatoto Village are committed to collective action, which is the first step in writing new storylines towards community transformation. I'm thankful to have shared just a little bit about Mamatoto Village, and I want to offer some about myself before we jump into the content, because when we are doing this justice-centered work, we are engaging in advocacy and policy to do three things: to embody justice, to advance justice-centered partnerships, and to develop justice-oriented solutions. As I said before, I'm the Senior Policy and Advocacy Manager at Mamatoto Village, and these are the three pillars of the advocacy, organizing, and policy team. We are really invested in amplifying the voices of those who have experienced any episode of injustice related to birth and reproductive realities. And in doing so, it is our opportunity, or we have the opportunity, to take our place out of community engagement and move ourselves into a relationship and process of community ownership. Meaning that those folks who are experiencing what is noted as a social problem are a part of developing the social solution. I also use they, them pronouns. So I'm a person who identifies as non-binary. And in the experience of womanhood, it's really important to me to see justice for all people who are able to participate in the birthing process. And that process is for people who are able to birth and those who are partnered with folks who are birthing. We all belong in this place of justice. And so as we move towards that reality, we want to come into relationship with some understanding. I lived in Fairfax County for a while and worked in Fairfax County for about 5 years, and Fairfax County, Virginia, excuse me. And there is this clip on the internet about a person who was in some position of power, who was removed from that position of power. And they were quoted in saying, does anyone really understand what systemic racism or systemic oppression is? And as I've done my research, there's no collective or unified definition that we can all agree to. However, there are some patterns that can help us to have an understanding of what we're looking at when we want to rectify this issue of Black maternal mortality and infant mortality. So the first one is structural oppression. And the way that I define this with the help of the Annie E. Casey Foundation is that it's the process by which disparities become negative health and life outcomes. So two examples under that definition are the school to prison pipeline and the fatality rates of Black women in cases of domestic violence. I've had an opportunity as a social worker to work within the domestic and sexual violence field and within school-based social work. And in both of those situations, in both of those settings, there's a disproportionality of Black folks represented in what is identified as the problem, that either being their behavior in school or their reaction or non-responsiveness, non-collaboration when dealing with legal systems such as the police or the court system. And ultimately, we see that those two things are indicators of a young person's presence in the justice system and a Black woman's fatality when involved in a relationship that is violent. So structural oppression, again, is a process by which disparities become negative health and life outcomes. And there's even an opportunity to have deeper understanding when we look at systemic racism. Systemic racism is the complexity of practices that use bias, discrimination, and stigma to hinder the progress of people. So our systems may be the housing system, where we have an example of redlining and home appreciation values that were evaluated for Black families. We also have another example of the disproportionality of Black children in American foster care systems. One of my first jobs out of college was working at a group home. And what I took note of is that there were far more Black children in our emergency shelters than in our long-term housing shelters for our group homes for young people. And this meant that Black children were being moved around the foster care system multiple times within a year without a permanent placement. There's a disproportionality of Black children in foster care systems that when looked at the larger population of Black children and families in that general area. So we have structural oppression, which is a process, and systemic oppression or racism, which is a complexity of practices. And all of these things prevent populations of people from making progress. We want to give a shout out to Black Feminist Future for giving us this understanding of patriarchal violence. Because if we look at the system as a whole, we know that we're experiencing structural oppression and systemic oppression. And then within our institutions, we have patriarchal violence, which is defined as the interconnected system of institutions, practices, policies, beliefs, and behaviors that harm, undervalue, and terrorize girls, women, femmes, intersex, gender nonconforming folks, LGBTQ populations, and other gender oppressed people in our communities. Patriarchal violence is one of the conditions of our communities that prevents us from making progress towards birth justice and reproductive justice. Because the ways in which systems harm us when using systemic racism or systemic oppression structures our ability to navigate options and realities that get us closer to freedom, get us closer to thriving, healthy futures, and ultimately eliminate the presence of health disparities in our community. When we're specifically looking at the healthcare system, we want to make note of medical racism, which again doesn't have a specific definition that we can all agree on, but we can look at the reality that systemic racism within medical and healthcare settings produces healthcare disparities, inequitable access, and bias against people of color, and disproportionately Black and African American folks. And the manifestation of that is on multiple levels. In the individual life of a person who is giving birth, their experience during that birthing process affects the family, the family connection or the family's responsiveness to that life that's being born. That family is a part of a larger community of people who either have similar experiences or have experiences with far better outcomes due to their proximity to privilege and resources. And ultimately, the system of care is not able to make progress on developing solutions for health equity amongst all people in all experiences. So when we think about structural oppression, systemic oppression, medical racism, and what these experiences can do to an individual, a family, a community, and ultimately the larger system, Mamatoto Village thinks about all of that, and we've made a committed investment into transformative justice. Bia Minga says that transformative justice is a political framework and approach for responding to violence, harm, and abuse. At its most basic, it seeks to respond to violence without creating more violence and or engaging in harm reduction to lessen the violence. Ultimately, transformative justice is about shifting the conditions within our community that makes violence, harm, and abuse possible. And I want to take note that I am using the words violence. I'm talking about patriarchal violence, systemic oppression, structural oppression, and medical racism, rather than using the term health disparity. Because when we think about health disparity, we're ultimately placing people as the problem, or the presence or lack of health in their life as the problem, rather than a system of care that has complex practices that result in stigma, bias, and discrimination, ultimately preventing the progress of all folks, but specifically Black folks. So as we are looking at achieving birth justice and reproductive justice, it is the political framework of transformative justice that will get us closer to that destination. In my time, as I was studying social work, I had an opportunity to take a public health social work position where we looked at health literacy as informed by shared decision-making and the model of shared decision-making. Shared decision-making is an approach where clinicians and patients share the best available evidence when faced with the task of making decisions, and where patients are supported to consider options to achieve informed preferences. There are many models of shared decision-making. The one that I offer as a graphic it offers a five-step approach to achieving shared decision-making within healthcare relationships. And those relationships are between the healthcare provider and the person seeking care, or the person who's identified as patient. And I want to invite everyone to just take a moment to look at the language on the screen and the steps, and then reflect on your positive healthcare experience, your most positive healthcare experience, and see what may be in alignment. So again, I'll read for you all. Shared decision-making is an approach where clinicians and patients share the best available evidence when faced with the task of making decisions, where patients are supported to consider options to achieve informed preferences. And those 5 steps that is offered in this model is to seek your patient's participation, help your patient explore and compare treatment options, assess your patient's values and preferences, reach a decision with your patient, and evaluate your patient's decision. When we think about shared decision-making and the research that's available to us on this model, we actually see that there is not enough guidance for healthcare providers on how to apply this as a perspective within the healthcare relationship. Other information that's available to us via research tells us that at that step number 5, where people must evaluate your patient's decision, there are multiple factors that may affect a patient's decision. One of those being healthcare literacy, the ability to understand the options and choices available to you, the accessibility to make every appointment and to build a relationship with your healthcare provider. And so ultimately, the evaluation of a patient's decision is often made from the same lens that we see within medical racism, where there's inequitable access and bias against people of color that does not allow for a person to make forward progress in their healthcare realities. So while shared decision-making is an approach that is valuable within the healthcare setting, It isolates the person who is the patient from having autonomy over how it is that they are engaged. When we have varying steps, such as within this approach, we don't have an opportunity to be our own advocates. Rather, it is the practitioner, the provider, the healthcare provider themselves, who is moving power rather than sharing power. Right? That means that the power can be moved to the patient and taken back. And in our critique of models such as shared decision-making, which are used in within the social problem of the Black maternal health crisis, we can see that shared power, or that collaborative and meaningful engagement, is still influenced by bias and discrimination that has been historical and is yet to be addressed. So remember, we are the why. Right? At Mamatoto Village, we know that we are the why. We are Black people, we are Black women who are caring for and developing the infrastructure to address the Black maternal health crisis by thinking about how you literally engaging with this content right now are the how. Right? That being, we're evaluating the strength of our relationships within community. We're thinking about our dynamics of interconnectedness. We know that Blackness is not a monolith. And so when we think about even the term, the Black maternal health crisis, who is it that we're talking about? When did attention come to the crisis? How is that attention distributed amongst all people, whether they are experiencing homelessness or housing insecurity or unemployment, or discrimination within their community? Do we understand how all of our interests are interconnected? And are we pursuing the depth of collaborative care, which is to include shared decision-making in the process and also shift power in a way that is meaningful and collaborative for all people engaged in the process of eliminating medical racism, patriarchal violence, structural oppression, systemic oppression and racism, and ultimately health disparities. So we are asking this question: how is self-advocacy possible within oppressive systems and structures? How is self-advocacy possible within oppressive systems and structures? When we face the reality of patriarchal violence, of systemic oppression, of structural oppression, of medical racism, and we understand that the individual is the answer. The individual who's experiencing care that restores their dignity or care that diminishes their dignity, they are the answer. So in my career as a social worker, I've spent a lot of time actually training advocates, specifically in the domestic and sexual violence field. And ultimately, we know that there are three things that allow someone to develop a well-rounded approach to advocacy. And in the next coming months, Mamatoto Village is going to be looking at how it is that we can define and develop self-advocacy as a process that complements things like shared decision-making. One of those things is relationships. We have to identify how it is that we're collaboratively caring for folks and engaging in the shifting power in a way that's meaningful for all people participating in the healthcare process. That power exchange ultimately has to be meaningful. So it's not enough to just say, well, I'm going to talk to the patient about this specific part of the procedure. It is about the entire healthcare process itself, from intake to discharge. And ultimately, self-advocacy for individuals is empowerment-based and influences people by making sure that they are having dignified interactions. In that process, a dignified interaction is one that acknowledges someone's autonomy and personhood. When we think about self-advocacy as something that can complement something like shared decision-making, it is not a process by which we are removing the knowledge and experience of our practitioners and our healthcare providers from the dynamics of decision-making. It is one where their knowledge and experience is complemented by your knowledge and experience, you being the expert of your own situation. And when we restore dignity to the relationships and we exchange and distribute power in a meaningful way, we know that this leads to positive outcomes in the field of domestic and sexual violence advocacy. And so we're looking at opportunities to complement or duplicate that in some ways for personal dynamics within the healthcare setting. So if you remember that text message that you sent to that number, I'm going to activate the next question. So again, all you have to do is text Raven Freeborn 506 to the number 22333. And the next question for reflection is, what barriers and challenges deter self-advocacy in healthcare systems? What barriers and challenges deter self-advocacy in healthcare systems? So self-advocacy, again, is the process by which you have a relationship with the healthcare provider where power is exchanged in a meaningful way. And ultimately, you are your most dignified throughout the entire experience. There's no threat to your personal dignity or your personal autonomy. And that your knowledge and experiences is as valuable as the knowledge and experience of the healthcare practitioner. So the question that we're asking is, what barriers and challenges deter self-advocacy in healthcare systems? And again, you text Raven Freeborn 506 to 22333. Answers that are coming in. Someone says just not understanding the process to engage with a healthcare practitioner that understands them. Someone else says feeling like I'm not using the right language to describe what's going on. Someone else says feeling disconnected from the healthcare setting itself. No central place to get correct information. Medical staff who are dismissive, short, and cold. Folks who are experiencing fear and a lack of time, and a provider who shuts you down. We're going to allow the responses to come back in. But when we have looked at barriers and challenges across the research and barriers and challenges, in our own lived experiences, we have identified the same things. Stigma based off of our sexual orientation or gender expression and identity. We've identified that folks feel like they don't have an opportunity within their schedule to even access a healthcare setting. A lot of people are saying shame, and that's something that we know has created stigma across almost all populations of people of color. Someone else has said doctors assuming what is best for the patient and talking them out of anything not in the doctor's plan. Time allowed to see patients, the managed healthcare process, being stereotyped, the workers think you're not educated. Ultimately, if we're thinking about self-advocacy as an opportunity to rectify the healthcare disparity and to eliminate the experiences of structural inequity, oppression, and racism, medical racism, patriarchal violence, then we know that one of the first steps in doing this is to explore the relationships that people have to the healthcare setting itself. So at Mamatoto Village, we're actually undergoing a capital campaign where we are where we are accepting donations to support the building that is being currently put together in Ward 8 of DC, or Ward 7, of DC. We know that just being able to access a place like a physical building where people can see you and understand you, where they value your time and where you have presence in the solution is a part of this social problem. Some other responses that have come in are providers who do not use accessible language, clinical staff describing patients as dramatic, providers not respecting me and my voice, access or financial barriers when a patient can't easily leave a provider who is providing racist or substandard care. You all are welcome to continue to share your experiences with us. We know that even when we experience some of the most positive healthcare, our interactions within the healthcare system, there are still barriers and challenges to our own self-advocacy. So sometimes for folks, that example from the first reflection also includes some of the reflection in this question about barriers and challenges. And ultimately, what we are preparing ourselves for is our future. So we're currently mobilizing and birthing a movement of collective care. And I want to talk about a few of these points while some of these reflections come in, and then we'll close with one more reflection question before we get to our questions. So one of the first realities of the movement that we are birthing at Mamatoto Village is to stabilize our presence east of the river. And so this is specific to the DC area, but the disparities in access and the disparities in care in DC, east of the Anacostia River, is one that is heavily prevalent in the data around maternal health and infant health for Black birthing people and their families. And so in order to stabilize this presence, one of the solutions is to continue with our work of providing team-based care within home systems. And the other part of that solution is building and opening our new space in the heart of Ward 7, where we're going to expand services and programs to include a full spectrum clinic, midwifery, and perinatal health worker training. We'll have more client meeting rooms. We'll have a milk depot, a lactation clinic, mental health services, family essentials pantry, and so much more. But ultimately, this is a part of our focus on supporting methods of historical and social solvency. So by that, we mean we know and believe in the social and cultural capital of Black people and of Black birthing people and of Black families. And that on their own and on our own, we exist as folks who are deserving and who have been resilient in the face of multiple centuries of oppression. So rather than continue to engage in the narrative around what we have lost, what we are up against, we are developing a new narrative that creates historic and social solvency. We are engaging in processes, especially within the advocacy, organizing, and policy team, to shift the dynamics of community engagement towards community ownership. Community engagement looks like speaking with folks just in the way that I am, right? This is a community engagement process, revealing the realities and the root causes of oppression that ultimately manifest as individual experiences of harm, violence, abuse, stigma, and discrimination. And that is community engagement. But our next most bold step in this work is to move towards community ownership, where rather than replacing the narrative with the history, we are seeking opportunities to engage in the real lived experiences and stories, amplifying those as social truths, employing and paying people for their expertise, and ultimately collaborating to develop justice-centered and justice-oriented solutions. We are scaling an iterative social change process. As a part of transformative justice, we know that we must shift the conditions that currently exist in order to move and make progress towards birth and reproductive justice. In doing that, it is our ultimate goal to continue with the processes of shifting change, observe where we may be failing, try again, and do better. When we recognize that our current system is actively failing us, we take full responsibility for the future that we are creating, knowing that we can't fail more than how we are currently being failed. And so we make choice to design futures where we are more dignified, where we're more liberated, where we have greater access, where our stories are validated and heard. We repeat that process and we scale up towards change that can be global, community-wide, revolutionary in some way. The crisis of maternal mortality in Black families is one that is rooted ultimately in the historical lineages of oppression, suppression, and community inequity. Policy and advocacy initiatives within our community require reckoning with the legacy of medical racism and its symbiosis with the manifestations of environmental and gender injustices. Finally, Mamatoto Village is a conduit that resources and amplifies the voices of Black women and their families to be witnessed, to be funded, and to be elevated as subject matter experts of the lived experience at the intersection of multiple oppressive identities, and those who are change agents, ultimately evaluating and implementing the justice-centered community solutions. I want to go back to some of the responses that have come in to our reflection question, which is what barriers and challenges have deterred self-advocacy in healthcare systems? Other answers are fat phobia in medicine, homophobia in medicine as well, not being validated as someone who is experiencing pain, navigating stigma, and expecting to be shamed in the process. So within these realities, we know it's our responsibility to craft the future. We know it's our responsibility to scale iterative change. And so ultimately, in this process, we acknowledge the lived experiences and the tides of oppressive systems that have evolved to maintain the status quo of adverse health outcomes across personal and generational lifespans of Black families. Ultimately, as a method of accelerating change, Mamatoto Village commits to documenting, sharing, and replicating community-based social change initiatives amongst a network of regional partners to leverage our present-day interests and action towards health equity. So we have a project that we are gearing up called the Village Keepers Council, which is a justice-based collective impact partnership that moves beyond the insular practice of things like memorandums of understanding and sets up a network of coalitions that are fueled with the knowledge of our Village Keepers Council, our Perinatal Health Corps, and our dynamic regional and national partners. Ultimately, over the next several months, we're going to be looking at self-advocacy as one of the initial components of creating change to complement the work that's being done within and around the healthcare system to eliminate health disparities, which we know are ultimately structural oppression, systemic oppression, patriarchal violence, and medical racism. So in that interest, we want to get to our final reflection question before we open up an opportunity for questions and answers. So again, I think we're all familiar. Text Raven Freeborn 506-22333 while I activate our third and final reflection question. And before I do that, while you all are setting up, this self-advocacy project is one that is going to complement our future policy and policy partnership organizing and advocacy activities. And so we are really settling and understanding what it means to embody justice. And in doing that, we want to tell a different story. So I really look forward to asking this final question and seeing the answers that come in. Imagine and discuss if you're in a room with other folks, but imagine and share through text, what does a dignified future look like for Black birthing people? I'll share some of my answer while you all send in yours. A dignified future for Black birthing people is one where there is a surplus of resource and understanding, where compassion is matched with collaboration, and there are opportunities to lead in seeking the answers and solutions to our present day problems, where we have the autonomy and agency to discuss the issues of our personal and family connections, and where our health is treated like a resource rather than a result. So that's my answer. That's what I think a dignified future looks like for Black birthing people. And I'm really curious about what you all have to say. In sharing your answers, this is going to help us to shape this self-advocacy toolkit that we're putting together. It's going to help us to understand how to frame the issue outside of the experiences of trauma that we're all aware of. And it's going to help us in seeking the future that we know that we deserve as Black birthing people and allies and comrades in the movement of maternal health, Black maternal health. So someone has said a dignified future for Black birthing people looks like being able to live equitably, lovingly, fully, and wholly. Someone else says enjoyable experiences, healthy bodies and spirits. Another answer, you no longer have to be afraid when becoming or attempting to become pregnant. Someone else has said laughing, dancing Black babies. As other answers are coming in, we're going to prepare ourselves for question and answers, but I just want to share my thanks with you all for engaging in this process and for thinking about and reflecting on your own experiences within positive healthcare situations, thinking about the barriers and challenges that you have had in self-advocacy, and also casting forward to imagine what it is on the other side of a dignified future. Other answers that are coming in. Research on Black birthing is considered safe with consequences for breaches in ethics. Where race is not a risk factor for fatalities from birthing, the Black Birthing Bill of Rights is celebrated and exceeded for all women. Thank you for sending that. A dignified future for us looks like respect and empowerment of our choices. Black birthing people can work with providers who look like them. So as other answers are coming in, some folks have, when we start talking about self-advocacy, there is oftentimes confusion about when you start in that process. Right? And so we know that self-advocacy is a process that begins as soon as you recognize that you're needing help and support from a healthcare practitioner. And self-advocacy ultimately begins with telling your story and telling your story in a way that complements your dignity, that does not distract from the care that you deserve, and in a way that you're not going to be surveillanced for your choices that you make as an individual. Some other responses from folks about a dignified future. For Black birthing people, it's a community where people are able to belong and create the family in a way that they want to. Okay. As a native Texan, I was born and raised in Texas. It is shameful and disappointing to see what's happening in my home state and to understand the consequences on the lives of Black people and their families. But to have the dignity and the opportunity and the autonomy to make your own decisions as you create the family that you ultimately want to be a part of is part of the dignified process of self-advocacy. As responses continue to roll in, I'm going to go back really quickly to a place here around transformative justice. So transformative justice as a political framework is different from that which is restorative justice. Restorative justice is often mentioned right now in our court systems, but ultimately transformative justice and restorative justice have their roots in Indigenous systems. Transformative justice differs though, because it's a political framework, which means that it is action-oriented. As a political framework, it gives us a perspective and a lens on which we can understand and view social problems, and it helps us to approach things from an ethical standpoint. Right now, the justice system that we're participating in is one that is retributive, which means that we are looking at action or consequences of harm and delivering just or equal consequences in some way. But again, if we look at structural oppression and systemic oppression, the consequence of those is further harm and violence as people are separated from their families, they're separated from their ability to create resources. So when we take transformative justice as a framework for birth justice and reproductive justice, self-advocacy becomes a tool in the political framework. It becomes a tool in which you can understand, or you have the resources to understand what's happening in your personal experience, whether that be in your body or to your body. You have the resources to engage with a practitioner who is able to maintain your personal dignity as you seek the care that you most desire. And then ultimately and finally, you have the resources to help in mitigating future harm to yourself or to others just through that transformative justice process. Right? And as you return to that final stop, you have shifted the conditions. So something that Adrienne Maree Brown says that I really appreciate is that if someone has caused harm in some way, rather than consequencing them, we're going to look at the situation that created the need for harm. And, some folks can argue there's no need for harm, but we'll look at that situation and then we will go back and evaluate what happened to create that and address those needs. So if there is hunger that created the consequence of harm, then we're going to address hunger. We're not going to address the harm. Well, we are going to address the harm through an accountability process, but that is not going to be our primary focus. We're going to look at the hunger. And in our birthing process, as we're experiencing injustice, or as Black bodies are experiencing justice within the birthing process, we have to consider the harm that happens to our personal dignity and ultimately the understanding of ourselves, and think about what are the conditions that created that. Some of those conditions, if we go back towards the slides, are the manifestations of medical racism, our structural oppression, systemic oppression, and patriarchal violence. And so as we have this unified perspective of care and process that is transformative justice, we know that we're responsible for creating the future that we most deserve and desire. And that's how Mamatoto Village is positioned as one of the leading agents of change in the DC area. A final quote that I see before I'll kind of close down is that Black birthing people can work with providers who look like them. Oh, I think I read that one. And this one. And that there is an opportunity to inform the process of healthcare from beginning to end. So we'll take this time to have questions. One question that came in is, how can we advocate for ourselves in a way that does not put us at risk of being reported for noncompliance or neglect when related to advocacy for our children? Thank you for that question. So kind of going through these steps, right? The first one is to seek out the relationship that has the least amount of risk to yourself or to the connectedness of your family system. So I don't know the specifics of this question. Maybe it comes from a personal experience, but we want to think about who it is that we are engaging with, who we're sharing our experiences with, and what responsibilities that person has within the relationship. So as a licensed clinical social worker, I share with folks when I am either doing therapeutic sessions or group sessions, I share with folks that there is an ethical responsibility that I have and hold if I am alerted of the risk of harm that someone has to themselves or to others, and that there are other relationships in the community of folks who there are other settings in the community where people are equally prepared to respond to folks' needs in a way that does not have such a high risk, right? So you want to first think about that. The second thing you want to weigh is the power exchange that must happen in order for you to have access to dignified care. So is it that someone is understanding you as, and not to speak to the person who asked this question, but, if someone is in a situation where their gender expression is being exploited in some way, does someone understand the dynamics of that? If there's a situation where someone's employment or housing status is under threat, what power exchanges do we have to participate in order to secure the resources in a safe way? Does that mean that you're going to engage in a social service agency, or does that mean that you're going to seek out a community organization that's engaging in mutual aid where resources can be shifted to you? And ultimately, the last way of advocating for yourself in a way that doesn't put you at risk is to manage your story for dignity, right? To make sure that your story is being told in a way that is in alignment with your experience as a person. As we're talking about the experiences of Black people, that story is being told in a way that aligns with the experiences of Black people. I hope that helps in kind of outlining how you can advocate for yourself in a way that doesn't put you at risk. And please stay in connection with us as we're looking to develop a toolkit that shares more resources on how self-advocacy can be outlined in relationships within the healthcare setting and the community setting at large. So today we've talked about the realities of health disparities, right? That health disparity is the manifestation of patriarchal violence, systemic oppression, structural oppression, and medical racism. And that there are models within the healthcare system, such as shared decision-making, that are intended to promote partnership in navigating the healthcare system between a healthcare practitioner and the person occupying the role as patient. I've shared a lot about Mamatoto Village and our values of caring, of seeing each other, of service, and our commitment to the transformative justice process, where we shift the conditions of inequity and injustice within the birthing space so that people are able to have their voices amplified in creating the solution that they most deeply desire. You all have reflected back to me some of your most positive healthcare experiences that you are deserving of. You've shared the realities of what it's like, what barriers and challenges exist that deter you from self-advocacy. And we have imagined and co-created this dignified future for Black birthing people, where we have resources, where we are seen, valued, and heard. It is my ultimate hope that we continue to engage in relationship together. If you're curious about the work that Mamatoto Village is doing in our policy advocacy and organizing team, please feel free to reach out to me. You can email me at raven@mamatotovillage.org. If you're curious about the work that Mamatoto Village is doing, we are connecting with folks around housing and justice in the DC area for Black birthing people and their families. We are looking to develop a coalition of partners who are going to be responsive to the intersectional issues of injustice for Black birthing people and their families. We are right now engaging actively in our capital campaign to open our building next year in Ward 7, right? That's really going to shift the experiences of healthcare for the folks in Ward 7 of DC and, that surrounding area. There's so much that we're doing, and there's so much more that is to come, because we are intentionally moving beyond this moment and into the most dignified future that Black people and their families deserve. So to stay connected with us, you can find us at Facebook by searching Mamatoto Village, or our handle is at Mamatoto Village Inc. And then on Instagram and Twitter, similarly, Mamatoto Village, no Inc., just Mamatoto Village on Instagram and Twitter. If there are no other questions, this is our closing moment. So I just want to express my gratitude for you all. As someone who is a clinical social worker, a doula, a healing justice practitioner, a Southern person, someone who is looking to start their own family soon, it is an honor to share this space with you all virtually, and just know that we are in partnership and solidarity as we move towards the future that we deserve. Thank you so much for your time. You all take great care.